I'm delighted to move this motion on behalf of myself and indeed my rural independent colleagues as well here this morning. But before I begin, I want to convey my sincere condolences and indeed the condolences of the group to Michael Collins and his extended family on the death of his nephew, which is no doubt a devastating tragedy for them all. Our thoughts and prayers are with them all at this very difficult time. Minister, it is absolutely clear that for many years now, rural communities have been struggling with attracting and retaining GPs and indeed locum GPs. Indeed, the HSE's own modelling suggests that by 2025, Ireland expects a shortage of between 493 and 1,380 GPs, mainly in rural areas. This coupled with an ageing population and the likelihood that many GPs are due to retire by 2026, and the figure of GPs that are due to retire by 2026, I understand, is 700. And this really does paint a stark picture ahead for rural health service. The emigration rates of young qualified medical graduates that continues to grow alongside this rapidly ageing population profile means that unless we get to grips with this emergency now, we are facing catastrophic outcomes in the years and indeed the decades ahead. We have all seen the recent Irish Independent study highlighting mounting health crisis in rural Ireland, whereby a severe lack of healthcare accessibility is causing strain on residents and leading to delayed diagnosis and treatments. The study also found that over 2/3 of GPs are currently not accepting new patients, which signifies a shrinking healthcare on the horizon in rural Ireland. But what does that mean in real terms? Worst case scenario, it means an early or unavoidable death or more intense and prolonged treatment. And that is really the facts and what we're talking about here. The lack of GPs in my area, in any area, and even my own area of Offaly, rural or urban, logically means that people who need to be seen quickly for a referral or initial diagnosis are not being seen. This can then lead to the development of conditions that might have been addressed more effectively if a GP or doctor had been available to diagnose or assess. From our perspective, all of these issues are being disproportionately felt in rural communities where we live and work. And what is truly alarming, however, is that when you look around the world, the same is true in rural communities almost everywhere. Even in Australia, where so many of our people are and our emigrants are heading, we have seen rural GP services and rural medical provision described as a professional wasteland. Indeed, in the UK, the Royal College of Physicians has previously warned that just 13% of consultants appointed in England last year went to hospitals serving mainly rural or coastal areas, with the other 87% being hired by those with mainly urban populations. Examples from other countries could be multiplied with ease. Coming back to our own country, what this reveals to me is that while Ireland is far from unique, rural communities must be prioritised in terms of the delivery of rural healthcare strategy that fundamentally addresses these kinds of geographical inequalities. I have no interest in getting up here and simply complaining about this horrendous situation. I want to, at the very least, point towards some solutions, such as those outlined in the Irish College of General Practitioners, ICGP, in its Shaping the Future discussion document last year. In its Shaping the Future discussion document, the ICGP outlined the 10 potential solutions it believes will help relieve the GP workforce crisis, as well as the non-EU Rural GP initiative. So, what do we need to do, Minister? We expand GP-led multidisciplinary teams. We need to at least double the number of GP practice nurses. and this is key. Many people think they need to see a GP, but a professional practice nurse can take the pressure off GP waiting times. We need to resource the career expectations of future GPs. Local GP roles can be seen as not very exciting or fulfilling from a career perspective, whereas many local GPs who actually do take up the role feel that it is at the heart of good medical practice and can be deeply rewarding when properly resourced. We must provide suitable premises for GP-led multidisciplinary teams, support suitably qualified GPs to take on GMS and medical card lists, increased remote consulting, but this may be more difficult where unreliable broadband unfortunately is still an issue. Many older people still prefer the personal touch. And the final point that the ICGP made as a solution was to increase exposure to general practice in medical schools. These are just some of the many ways, and indeed some of the many solutions that have been put forward that we can, I suppose, put in place to help rejuvenate rural GP services, Minister. I'm aware that the non-EU Rural GP initiative is aimed at addressing the issue of brain drain faced by the Irish healthcare sector by attracting non-EU doctors to rural general practice, and that this has led to about 50 participants taking part, and that's to be welcomed. The ICGP, as we know, has previously stated that it wishes to attract at least 100 such doctors to Irish rural practice throughout 2023. While this is welcome to some degree, there does appear to be very real ethical issues and the ethical issue of taking away medical professionals from what may be already poor or underdeveloped areas, particularly where we have a substantial number of our own graduates who could be motivated or incentivised to stay at home and work here. I accept that there are no easy solutions, but at the same time the policies that have been adopted to date unfortunately have failed. There is a myriad of complex and intersecting issues relating to this crisis, among them the sheer unattractiveness of living and working in Ireland in terms of the lack of housing, sky-high rents, an insurance sector that seems almost designed to exploit, and all of these things make it more difficult for GPs who are private practitioners to be able to choose a professional life here. The longer these issues prevail, the worse the situation becomes, because existing pressures are then deepened, which in turn leads to professional burnout and which in turn leads to even more pressure onto what GPs are available. Mention has also been made about the capacity constraints that now exist. We have a government prioritising free universal access when the capacity of the system to absorb those numbers is just not there. We need targeted supports for the vulnerable in rural and urban communities. And what we absolutely do not need is more of the same failed and failing policies whose only outcome has been to deepen a GP availability crisis that shows no sign of abating. Gareth Margaret.